Hello, welcome to the Municipal Archives presentation of Going Viral, Spanish Flu to COVID-19, A History of Influenza in Savannah. My name is Kelly Zacovic, and I am the Archivist for the City of Savannah Municipal Archives. So a little bit of background on this project. I prepared this presentation during the 2020 COVID-19 pandemic as a way to share the history of pandemics in Georgia and in Savannah in particular. Savannah has a long history of overcoming pandemics, many of which are well known, such as the yellow fever outbreaks of the 19th century. So I wanted to spend a little bit of time on the 20th century outbreaks as well. Spanish flu was the deadliest pandemic in modern history, and I know a lot has been written on it in recent days, but hopefully I can share a few interesting tidbits with you today. So let's jump right in. Spanish flu, an influenza strain known as H1N1, and if H1N1 sounds familiar to anybody, it was a distant relative of the H1N1 strain that appeared in 2009. So Spanish flu first appeared in 1918 and plagued the globe through 1919 and then recurred seasonally for another 30 plus years. The geographic origins are actually still a bit uncertain, with some epidemiologists speculating that it started in Great Britain, France, or China. What we do know for sure, though, is that it was the first recognized cases of this new menacing illness that would become Spanish flu happened at the military base at Fort Riley, Kansas in March of 1918. Therefore, the name Spanish flu is a bit misleading, as it did not actually originate in Spain. Instead, the name was born out of a false impression that Spain was hit particularly hard by the virus. Many of the hardest hit countries, such as England, France, and the US, were often prone to underreport the severity of the flu in order to help maintain a morale among their civilian populaces. The combination of a devastating war and a devastating flu would really kind of be a lot to handle. During World War I, though, Spain remained neutral, and therefore their news outlets were more able to freely publicize the toll the virus was taking on the country, leading to the false sense that there were more cases there than other places, and that's how the name Spanish flu was born. Throughout the roughly 18 months that Spanish flu besieged the planet, more than 500 million people were infected. Of those 500 million people, 50 million died. 675,000 of those were Americans. One of the more interesting statistics that I encountered while doing this research relates to the impact that the pandemic had on the average U.S. life expectancy. In 1917, the average U.S. male life expectancy was 48 years, and the female life expectancy was 54 years. After the flu ravaged the country in 1918, it reduced the average life expectancy for civilians by 12 years, making it 42 years for men and 36 years for women. So that really just shows the monumental impact it had on our society. The disease did not discriminate between races or gender. Unlike many other diseases, though, the hardest hit age demographic were adults aged 18 to 50, rather than the more typical extremely old, extremely young, or those with other illnesses. The disease struck in 3 major waves. The first wave began in March of 1918 in the United States. It lasted throughout the spring, but petered out by the summer. The second wave, which was by far the most deadly, occurred in September to October 1918, with the middle of October being the most deadly period during the pandemic. 195,000 Americans died in October of 1918 alone. The third wave occurred after Thanksgiving in November of 1918 and lasted with decreasing severity through the summer of 1919. The third wave was stimulated in part because of the reduced protections after the peak of the pandemic, as well as the national armistice celebrations that occurred. The H1N1 virus did not completely go away after 1919, though. It did continue to circulate as a seasonal affliction for another 38 years. You really cannot separate the history of Spanish flu from the history of World War I. I'm going to go into this history and how it related to Georgia a little bit more in depth later in the presentation, but I wanted to touch on the fact that military bases, training camps, troop movements, and battlefield conditions played a monumental role in the transmission of Spanish flu. World War I and influenza collaborated. The war fostered disease by creating conditions in the trenches of France that some epidemiologists believe enabled the influenza virus to evolve into a killer of global proportions. In turn, the disease shaped the war effort by rendering much of the armed forces non-effective for long stretches of time and diverting resources, personnel, and human energy away from the military campaign. Overall, in World War I, roughly 53,000 U.S. troops died as a result of battle, and 63,000 died from disease, with Spanish flu as the far and away leading cause. In total, more people died globally of the influenza than all 20th century wars combined. So, while doing the research for this presentation, I was struck by the similarities between our current COVID-19 epidemic and that of the Spanish flu. Even the newspaper reporting was so very similar. So, I thought it'd be fun to do a little quiz and see if you can guess if these headlines are from Spanish flu or from COVID-19. So, here's our first headline. The only way to stop the spread of blank is to close churches, schools, theaters, and public institutions in every community where the epidemic has developed. Is it Spanish flu or COVID-19? If you guessed Spanish flu, you were correct. This newspaper article from Atlanta in 1918 that shows that even then, health officials recognized the value of mandating social distancing and wanted to take swift measures to protect citizens. All right, our second quote. In an effort to slow the spread of blank, Savannah Mayor blank issued a local state of emergency, which mandates several business closures and restrictions in addition to implementing other measures to limit gatherings. Spanish flu or COVID-19? It was COVID-19. This was Mayor Johnson's remarks on March 18th about closing down many of Savannah's businesses in order to hopefully get ahead of the spread of COVID-19. The previous article from Atlanta was dated October 4th, which was before really the peak of the epidemic hit, and Mayor Johnson's order came in mid-March, which again was fairly early for the timeline of COVID in Chatham County. So our third and final, here's the article. Our third and final quote. What a flu mask may hide, what wrinkles, what smiles, what tears, what other man's wife may only be surmised following an order made yesterday that required masks be worn in public. This was a Spanish flu quote. This article discusses the mandate to wear protective masks at the Southeastern Lakewood Fair in October of 1918. This fair was, of course, outdoors, and the fact that it even held was quite controversial, since so many other recreational activities were canceled. But officials believed that if something was outside, if there was available fresh air, it would limit the spread of disease. The fair was certain to bring crowds, and many were wary that it would be a breeding ground for disease nonetheless. This article is actually quite humorous, so I just wanted to read a further passage. Shows that even then masks were, shall we say, a bit of a talking point. The article reads, quote, "But as yet the possibilities of the mask are undeveloped. Think of the women whose teeth fail to fit. She may be beautiful in a mask. Think about the agony that jealous wives and husbands will suffer as they wander around the grounds, stealing searching glances at the masked faces that pass." Then it goes on to say, "The mask has proven indispensable in trench warfare, where it gives a certain security to the wearer. Is Atlanta so far from the line of powder and paint that she cannot also bask in the security of the mask?" So the author, though poking fun at the mask, is pointing out the severity and the importance of wearing it nonetheless. So now that we've had a little bit of a game, I will transition a bit more into the history of Spanish flu in Georgia. Here in Georgia, the story of Spanish flu followed much of the same trajectory as the rest of the country. The first cases of what at the time was a new novel sickness, sometimes called the grippe, appeared in Georgia at military training camps near Atlanta on March 18, 1918, only a few days after it was reported for the first time in Kansas. At the time, influenza was not a widely recognized disease, nor was it one that was required to be reported to health authorities, so the early stage of its spread here are largely unknown. By September 1918, the disease was widespread enough that the Georgia Department of Health declared it a reportable disease and a formal collection of morbidity statistics began. By October, the state health department reported mortality rates and declared that there had been 6,304 cases and 68 deaths. In 1918, there was no nasal swab test to diagnose influenza like we have today, so these reported numbers were based on what amounted to basically the highly trained speculation of doctors and health officials. Adding to the confusion in reporting, many patients died of secondary infections caused by influenza, such as pneumonia, and therefore it's likely that many deaths actually caused by influenza did not get captured in the state's mortality statistics. With all these other things taken into consideration, along with a few other complications, such as the lack of centralized records keeping, and even the legibility of a hurried doctor's handwriting, in all likelihood, these numbers were far higher for Georgia. The Georgia Board of Health 1918 annual report sheds a lot of light on the influenza situation in Georgia. The report starts, "The year 1918 was an unusual year in health work. The heavy demands made on the medical profession by the War Department and the unusual epidemic occurring during this year have made it very hard indeed to carry on any particular line of work." In a segment of the report dedicated to Spanish flu, it reads, "We will never know how many succumbed to the disease in Georgia, but the death rate has been very high," further emphasizing that even at the time, health officials knew that the full scope of the pandemic was beyond them. Communities that lacked adequate numbers of doctors and nurses could petition the Board of Health and the Red Cross to have them deployed to their areas, and the report boasts that all towns who asked for assistance received it, even if they could not send as many people as were requested. In another interesting passage that points to the lack of understanding of the nature of the influenza virus, the report discusses sending a state bacteriologist to hotspots of the epidemic in order to determine what bacteria was causing it in order to begin formulating a vaccine. Since, of course, influenza is a virus, they were not successful in this venture, but they were able to determine the bacteria that most commonly appeared in patients with secondary pneumonia infections. The report reads, "Even today, the bacteriologists have not determined the exact organism causing influenza. They have determined definitely the type of organisms that are causing deaths following influenza." By December, the state health department had successfully prepared and begun distributing a vaccine to protect against the deadly pneumonia. Despite some reservations about how the vaccine would be received, the state reports that the demand far exceeded the laboratory's ability to produce it. This page shows the death statistics for the year. Of course, influenza was the highest, but the second highest were gonorrhea and syphilis. The Spanish flu came to Camp Gordon outside of Atlanta on September 18, 1918. Much of the camp was put on quarantine after a small scattering of cases appeared after troops returned from a training exercise. This quarantine prohibited soldiers from entering dining halls, amusement venues, and other indoor gathering spaces. Later, they were required to wear masks and keep stringent sanitation protocols, even were required to sleep outside in order to ensure effective social distancing measures. Importantly, the soldiers were also prohibited from going into the city of Atlanta in order to try and protect the civilians there. By the end of October, more than 2,000 troops at Camp Gordon contracted Spanish flu and 94 died. On October 7th, the U.S. Surgeon General encouraged state health departments to enact social distancing guidelines for their states in order to help limit the spread of the flu. In Georgia, the state health officer, T.F. Abercrombie, decided instead to allow each municipality to decide for themselves what measures they needed to take to protect themselves. On the advice of Abercrombie, the Atlanta Board of Health decided to close all schools, libraries, theaters, cinemas, churches, and all indoor public gathering places and imposed a hefty $200 fine to anybody caught violating the order. Streetcars had to operate at reduced capacity with windows completely open, and passengers were required to wear a mask. As a result, these stringent early measures, Spanish influenza did not take as heavy a toll in Atlanta as in other major metropolitan areas. In fact, the U.S. Census Bureau reported that Atlanta had the lowest death rate in the Southeast during the second wave, though there is some cause to doubt that fact based on the previously mentioned lax reporting guidelines. And I just love this thing. It is an article discussing the impacts of prescribing whiskey as a flu treatment. So with the success of social distancing measures, the Atlanta Board of Health decided to reopen facilities a mere 2 weeks after they were closed, which is a controversial decision to say the least. Some restrictions remained in place, though, such as limiting hours for theatrical and cinematic showings and refusing entry to individuals who showed symptoms of the dreaded disease. The early reopening did backfire to a certain extent, though, as the third wave of the epidemic hit Atlanta particularly hard and evened out any advantage the city's health statistics had over other regional locations. While reading about the epidemic in Atlanta, I came across a perspective that was relatively new and very interesting to me, which connected the dots between the civilian war effort and the pandemic. Atlanta in 1918 was powered largely by hydroelectric power generated by the Tallulah River. The Tallulah River at the time was running low, which posed a threat to the power that ran the city's wartime factories. As a result, there was an effort to conserve electricity as much as possible, which included initiatives like rolling blackouts in city neighborhoods, continued limitation on the operation of movie theaters, limited streetcar service, and limited hours of operation for restaurants and shops. All of these measures, separate from the efforts of the Board of Health, serve to impose social distancing measures and limit the amount of people out in public that could transmit the disease. After all was said and done, around 830 people died in Atlanta of the Spanish flu. Spanish flu impacted all sectors of life, including popular culture and literature. One of the most famous books ever set in Georgia, Gone with the Wind, may have taken some inspiration from the tragedies of 1918-1919. The author, Margaret Mitchell, was in school in Massachusetts during the Spanish flu outbreak. Upon hearing that her mother was gravely ill, she boarded a train and headed home to Atlanta to be by her bedside. Sadly, her mother passed away before she arrived home. Margaret was only 18. Though Margaret Mitchell has long denied that characters in her book were autobiographical, many biographers have noticed a strong correlation between her story and that of her famed character Scarlett O'Hara. After having narrowly escaped the burning of Atlanta and enduring a treacherous journey home to Tara, which is the family plantation, Scarlett is greeted by an unexpected reality. Her home has been devastated by war and illness, and her mother, Ellen, lies dead of typhoid. Scarlett is too late to even say goodbye. She was only 19 years old. It's really hard not to see how Margaret's own personal experience with Spanish flu may have influenced her emotional telling of Scarlett's life. So at this point, I do want to point out that researching the state of affairs in Savannah during the Spanish flu has been a little bit challenging due to the closure of local research repositories that hold invaluable resources such as the newspaper archives and subject folders. So I hope you'll forgive me if a few of my anecdotes have covered areas outside of Savannah. Luckily, though, limited editions of the Savannah Tribune are available on Genealogy Bank, so I've not completely been without local resources. And if you haven't checked out the Savannah Tribune, it's an amazing resource with absolutely fascinating articles, so I highly encourage it. Here in Savannah, many of the same social distancing measures seem to have been implemented. Large gatherings, church services that were not held outside, even school was canceled in the fall of 1918. The disease, like so many other places, peaked in October of 1918, but recurred later in the winter, forcing at least 3 total shutdowns of public gatherings. The following is a brief timeline of events according to the Savannah Tribune. So on October 12th, the first shutdown occurs. All schools and other public gathering places are to close today. And this is the headline. I think this headline is a little bit funny because on one side we have the notice about public gatherings closing. On the other side, a big patriotic Liberty Bond parade will take place this afternoon, which, as far as I'm aware, it's pretty difficult to socially distance a big parade. So there's some conflicting things happening here. On October 19th, the headline reads, 2,500 cases of Spanish flu reported in this city, 44 deaths from the disease. This article is one of the best that I've found that gives insight into the state of affairs in Savannah at the height of the epidemic. Health facilities were still segregated, and we learned that several nurses had been appointed to look specifically after patients of color. I can't imagine the workload for these, quote, several nurses in the face of the disease with this scope. Nurses really have always been our heroes. The article points out that these nurses could be summoned free of cost. It also lists restrictions on businesses, which mainly consisted of curfews of 6 o'clock for stores, except drugstores, and food stores could remain open until 8 p.m. The article finishes by encouraging readers to court the open air and have all windows open and keep their homes in the most sanitary of conditions. One of my favorite anecdotes from this time in Savannah is also reported here. Businessmen donated the use of their cars for nurses to make house calls and solicits the use of several more. It's a nice reminder that even when things are pretty grim, there have always been people ready to step up and help. On October 26th, and I apologize for not including this visual, but the article was quite faded and it would probably just cause more confusion. In October 26th article in the Tribune, it praises the commitment of all levels of Savannah society, from legislative forces to public cooperation. It says, quote, there can be no finer example of the splendid and successful results of a city's willing and vigorous cooperation than is exhibited in the way all hands joined in with the health department and stamped out the flu. Charitable organizations, war work agencies, churches, and individuals have responded nobly and sacrificingly to this great call for service, end quote. Sometime in November, a second shutdown was called for, but I was not able to find an article for it. And we know this because on December 28th, the newspaper reported a second shutdown, which had lasted for 1 month, was finally lifted, and Savannians poured into the street to celebrate. This celebration might have been a little bit early, though, and it was definitely cut short, as yet again, on January 18th, 1919, another public closure was called for, this time with the author resigned to a long siege of the quiet life this time. An ordinance passed on January 15th affirms this quarantine and shows the requirement of closing moving picture shows, houses, churches, schools, and other places of assembly, and regulating the use of streetcars, as well as the hours that businesses may operate. There is a penalty of up to a $100 fine or imprisonment for 30 days for violating this quarantine. In addition to closing public spaces, this time the local Board of Health also called for all homes that housed infected or possibly contaminated individuals to have a placard hung from them indicating their status as an infected home. This was a controversial decision, but ultimately the board felt that it was an effective way to help slow the spread of infection. At the onset of this policy, an initial 59 houses were placarded. Much like the rest of the world, the influenza epidemic had lasting impacts on Savannah, as can be seen in this section of City Code dealing with public health and sanitation following the pandemic. An ordinance was passed in 1918 that required all plates, cups, and silverware be washed before it be used a second time. In 1920, the ordinance was updated to include the fact that all drinks served at public drinking fountains and all soft drinks be served from single-use paper cups stored in plain sight, and that no cup is to be reused. Even a year out from the Spanish influenza pandemic, local officials were still thinking and refining the best ways to protect citizens. All in all, according to a 2018 statistical analysis of Chatham County death certificates, there were 316 fatalities from Spanish flu in the Savannah area. Of those 316, 114 of them occurred in October of 1918 alone. There may be additional cases that were recorded as secondary infections or that were illegible to the researchers compiling this information, so these numbers only list the causes of death that were strictly listed as influenza. So while looking into the impact of Spanish flu on Savannah, I could not look at the impact the pandemic took on World War I troops from Chatham County. In 2018, in order to remember the centennial of the end of World War I, we put together several programs and lectures and had a wonderful intern who prepared our World War I documentation project, which identifies and assembles biographical information on Chatham County's fallen service members. Chatham County lost 126 members during the course of the war. Of those 126, 33 are listed as having died from pneumonia, influenza, or other unidentified diseases. 3 of those had influenza specifically noted on their death records, and 27 died of pneumonia. 17 of these troops died of disease in October 1918, and several others died in late September or early November, indicating that they too were most likely victims of the dreaded flu. Often, service members were struck down by the flu before they even reached the front. One such soldier was Alex Gray. Gray was born in Savannah in 1889, though his draft registration indicates he was unsure of his exact birth date. Prior to the war, he worked as a butcher in Savannah's city market at J. Rahan's. Along with his wife and child, he lived at 112 St. Gall Street along the western edge of Savannah. After joining the military in August of 1918, Gray served with several receiving companies at Camp Wheeler near Macon and with the 342nd Labor Battalion at Camp Alexander in Newport News, Virginia. African American men without specific skills or who otherwise might be unfit for combat. Gray was recorded as having a, quote, stout build, and he signed his draft register with a mark, indicating that he was likely illiterate, were commonly assigned to labor battalions that carried out a variety of manual labor duties, from unloading supplies to feeding horses and mules. Gray contracted influenza while serving at Camp Alexander, and the illness progressed to bronchopneumonia before he passed away on October 17, 1918. African American soldiers in general had a lower rate of infection on average, but a higher mortality rate. This can be explained in part by segregationist policies, which might have shielded African American soldiers from the brunt of infection by limiting their interactions, but their generally poor living conditions, sanitary conditions, and poor diet, as well as reduced access to medical care that they were often susceptible to, contributed to the poor outcomes for those who were infected. A recurring theme in research about Spanish flu in World War I is that the massive number of medical professionals that the war effort required meant that often communities were left without adequate number of doctors and nurses to tend to the influx of influenza patients. Savannah was no stranger to this phenomenon. One of the city's top medical officers at the time, Charles Middleton, was drafted into service in 1917 and served throughout the war, where he undoubtedly tended to many victims of Spanish flu. Middleton was born in Savannah in 1886. In 1913, he was working as a physician, and by 1917, he was a city physician for Savannah. Middleton lived with his wife Jenny and his 2 daughters, Catherine and Amanda, on East Charlton Street before the war. He was drafted into service in 1917, entering the Medical Corps for the 349th Field Artillery as a first lieutenant, and he was quickly promoted to captain. On August 1, 1917, he petitioned the Savannah City Council for a leave of absence for the duration of his service, which was granted without pay. He served from June 1918 to March 1919, and he returned to work as a physician in Savannah later that year. Dr. Middleton moved to New York by 1940 and registered for the draft in World War II. Middleton died in 1955 and is buried in Long Island National Cemetery. So now I want to shift gears a little bit away from Spanish flu and into the other pandemics of the 20th century. Perhaps you're like me and were very surprised to find out that there were in fact other public health crises and influenza pandemics in the 20th century, other than Spanish flu. So with the help of our wonderful administrative assistant, Amanda Williams, we've put together a few interesting facts about these events. Perhaps you've seen this graphic floating around the internet recently, but I really like it because it kind of puts into perspective all of the different diseases that have impacted people throughout history. It's an infographic produced by the CDC and the World Health Organization. Since this was produced, the COVID death toll has jumped significantly, putting it ahead of yellow fever. I don't really want to talk too much about coronavirus, though. I just wanted to point out another few flus that have impacted Georgians in particular. Of course, from this you can see that Spanish flu is basically the granddaddy of all deadly flus with 40 to 50 million deaths. But I also wanted to talk about some of the less familiar pandemics, including Russian flu, Asian flu, and the Hong Kong flu. So we will start with the Russian flu, the earliest of the pandemics to hit Savannah. It appeared between 1889 and 1890, but it also reappeared throughout time. Like many flus, its symptoms included weakness, sore throat, body aches, fever, inflammation, headaches, pneumonia, and rashes. Russian flu was a highly contagious strain that was spread by human contact. It originated in the Russian Empire, but the ever-expanding railroad and steamship networks that crisscrossed the globe assisted in its spread beyond Europe. In the 2 years of 1889 and 1890, about 1 million people died worldwide. Treatment for Russian flu was much the same as Spanish flu, since the invention of vaccines or antibiotics were still a ways away. It was treated in an individual way between the doctor, a druggist, and the patients in order to best treat the symptoms. Many people thought it was a seasonal cold that would go away with rest, and Savannians tended to think that local weather would prevent it from appearing here. The Russian Tsar Alexander III and Prince Albert Victor, Queen Victoria's grandson, are among the most prominent people killed by the pandemic. The next influenza pandemic to occur was the Asian flu of 1957 to 1958. Nearly 1.5 to 2 million people worldwide died, and 70,000 people in the United States died. Luckily, by this point in history, antibiotics were common, and scientists were able to develop a vaccine fairly early on in the pandemic. In 1968, the Asian flu appeared, and the Asian flu was found to have mutated. By 1968, the Hong Kong flu appeared. The Hong Kong flu was actually a strain of Asian flu that had mutated. It was another highly contagious virus, though it had a relatively low death rate, and it caused chills, fever, muscle pain, and like other flus, often developed into pneumonia, bronchitis, and other pulmonary complications. Though it killed 1 million people worldwide, those who had contracted the earlier Asian flu were immune to the Hong Kong flu. Much like Spanish flu and our present situation, many states had to close schools, restrict public gatherings, and restrict travel in order to keep their residents safe. A vaccine was developed to limit the spread of the Hong Kong flu, but unfortunately it was released only after the peak of the epidemic in many countries. Well, that is all I have for you today. I hope you enjoyed this presentation, and please be sure to check out more of our Hungry for History presentations available online at www.savannahga.gov/educational resources. Thank you.